So I'm going to begin by entering Mr. Mancini's room and bringing the MAR with me to his bedside. And the first thing I would do when I go in is I would check for 2 patient identifiers. So I could use either his first and last name, his date of birth, or his patient identifier on his wristband. And the next thing I would do is check his MAR for accuracy and completeness. So looking at his MAR, his name is Mario Mancini. His diagnosis is pneumonia, and he is allergic to codeine. His medication order is heparin, 5,000 units subcutaneous every 12 hours. And he's also supposed to get Haldol, 1 milligram intramuscular every 4 hours as needed. And I would also make sure to keep in mind the 8 medication rights, which is right patient, right medication, right reason, right dose, right route, frequency, time, and documentation. I would then want to assess Mr. Mancini's body build, muscle size, and weight, as this relates to the size of the gauge and the length of the needle that you would want to use. So if he was on the bigger side, you'd want to use a longer needle and a smaller gauge. And if he was on the smaller side, you'd want to use a shorter needle but a bigger gauge. For a subcutaneous injection, I will be using a 25 to 27 gauge needle. So I'll be using this needle here, and it would be 9.5 to 16 millimeters in length. And for an intramuscular injection, it would be 20 to 25 gauge. So this one right here I'm going to be using, and it would be 25 to 38 millimeters. So for the heparin 5,000 unit subcutaneous injection, I'm going to be giving 1 milliliter in the 3 milliliter syringe here. And for the Haldol 1 milligram intramuscular, the supply is 4 milligrams per 2 milliliters. So I'm going to be using the 1 milliliter syringe, and by my calculations, I'd be giving 0.25 milliliters of Haldol. So I'm going to perform my hand hygiene, and then I'm going to get the syringe and the needle ready for the subcutaneous injection. So I'm going to start with grabbing my syringe, and then I'm going to attach it to the blunt fill needle. And take it out. So I'll begin by taking the top off the vial and cleaning it with my alcohol wipe. And I would dispose of that. And then what I'm going to do is I'm going to pick up my syringe, and I'm going to take 1 milliliter of air into the syringe. I'm going to carefully remove the cap on the needle. And I'm going to insert it into the vial. And then once it's in, I'm going to push the 1 milliliters of air into the vial and turn it upside down. And pull back 1 milliliters of the medication. So I'm going to get out any air bubbles that I have in my syringe by pushing up a little bit. And once I've done that, I'm going to recap it for safety. And then I'm going to remove. And I'm going to attach it to the 25 gauge needle. And then I'm going to dispose of this in the sharps bin. The last thing I'm going to do to prepare for the subcutaneous injection is to make a label for the injection that has Mr. Mancini's name, the drug that he's receiving, and the dose, and I would attach that to the needle. So now I'm going to assemble my syringe and my needle for my intramuscular injection. So I'm going to start with getting my vial, and I'm going to take the cap off of it, and then I'm going to clean it with my alcohol swab, and then dispose of that in the garbage. And then what I'm gonna do is I'm gonna grab my 1 milliliter syringe and attach it to here. So now that I have my blunt fill needle on, I'm gonna pull back 0.25 milliliters of air into the syringe. And then I'm gonna safely remove the cap. And I'm gonna grab my vial and I'm gonna insert the needle into the vial. And I'm gonna push the air in. And I'm gonna turn it upside down. And then pull the 0.25 milliliters of the medication into the syringe. And now I'm going to get out any air bubbles by pushing upwards on the syringe. So now that I have my needle labeled, I can throw the blunt fill needle in the sharps bin. So I would perform my hand hygiene to start, and then I would put my gloves on. I would then go into the room and confirm that I have the right patient with Mr. Mancini, so I could ask him his first name, his last name, his date of birth, or I could check on his bracelet for his unique patient identifier. And I would also make sure to check my MAR again to ensure that I'm giving the correct medication. I would then explain the procedure to Mr. Mancini, so I would let him know that I'm going to be giving him a subcutaneous injection, which goes into your adipose tissue, and I would most likely be using his abdomen for that, but I could also use the outer aspect of the upper arm or the anterior part of the thigh. And I would also let him know that I'm going to be giving him an intramuscular injection into his deltoid, because it's less than 2 milliliters, so it's safe to put in his deltoid, but I could also use his ventrogluteal muscle, or I could use his thigh. So for my subcutaneous injection, I would start by palpating the abdomen, just looking for any lumps or bumps or any sign of bruising or tenderness, and I would pick the correct spot. And then what I would do is clean the area. So I'll take my alcohol swab and clean around the area, and then dispose of that in the garbage. So I'm gonna remove the cap on the needle. And then I'm going to squeeze with my non-dominant hand while I'm holding the needle in my dominant hand. And I'm going to go in at a 45-degree angle for the subcutaneous injection, because Mr. Mancini is smaller, but if he did have more adipose tissue, then I could also go in at a 90-degree angle for a subcutaneous. So I'm gonna pinch the skin, and I'm gonna go in at a 45-degree angle. And then I just wanna let go and stabilize my needle, and then I can inject. And then I will remove it. And I wanna make sure that I am recapping my needle for safety. And I would be disposing of it in the sharps bin. So now I'm gonna be doing my intramuscular injection into Mr. Mancini's deltoid. So I would start again with palpating, looking for any lumps or bumps or bruising in that area, and it looks to be good. So what I'm gonna be doing first is I'm going to clean my injection site, and then throwing that in the trash bin. And then I'm going to be removing the cap on my needle and setting that down. So for an intramuscular injection, I would do it at a 90-degree angle to the muscle. So first I'm going to pull the muscle taut, and then I'm gonna go in at a 90-degree angle. I'm gonna stabilize my needle, and then what I'm gonna do is I'm gonna pull back a little bit just to make sure I'm not getting any blood, which would indicate that I'm in an artery or a vein. And I'm not getting any blood, so I can go ahead and inject the medication into Mr. Mancini and remove the needle. And then what I'm gonna do is I'm going to recap the needle for safety. And then I can dispose of it in the sharps bin. For my documentation, I would keep the 8 rights of medication in mind, and I would make sure to document that I gave Mr. Mancini a subcutaneous and intramuscular injection in a timely manner. And then I would also make sure to check back with Mr. Mancini in 15 minutes and look at the injection site for any redness or swelling or pain or itchiness, which would indicate an allergic reaction to the medication that I had given him.